Hi everybody, today we are talking about the new subject. It's a plasma injection for treatment of the muscle or tendon injury and also for osteoarthritis change in the joints. All of us we know that the body has ability to recover or repair the injury whenever it's happened during the sport or during the aging process. The most important thing in the body, they have the ability to recover the injury site after happening the sport, after the sport injury or after the oil change. Today we are talking about the plasma, how the plasma is working and what is the plasma. All of us, we know that the blood is contained of the three parts, which is the plasma is a media for the white blood cell, red blood cell and the platelet. The plasma, how it work after the injection. We take the blood from the patient and we put it in the centrifuge. After that, we take out the plasma with full rich platelet. And after we inject the platelet to the site of the injury, the platelet, what it contains? It contains the growth factor. The growth factor that is have ability to recover or to repair the injury site. That's the briefly about the plasma, how it works. Other questions that the patients too many times ask about that the plasma is the treatment for what patients or what good condition. Really it is a treatment for the musculoskeletal injury after sport or OA change after the aging process or after the trauma, the fracture at the joint especially. Other questions the patients ask, how long the PRP injections last? Really it's about 6 to 8 months. The effect of the plasma, it will be stay at the injury site. Sometimes it will be more and sometimes the patient it will be recovered definitely and sometimes it's not, it will be regained. It depends on the patient how he or she can preserve his body activity and his sport, and he will avoid the mechanism of injury again. Other questions, does the plasma really work? Yes, it is the normal mechanism of the body to recover the tissue injury. The plasma they contain the large numbers of the protein, growth factors, and the tissue repairing component. By this mechanism, it will be helped to recover or repair the injury site, especially at the muscle or the tendon. As a generally, the plasma also they have the side effect, but if you compare with the steroid or with other injections, they have the less side effect. The side effect of the plasma is about the site of the injection. Maybe it will be caused, if it is unsterile, it will be infected, making the pain at the site of the injections, and also may patient not get benefit from the injection, and also after the injection there's a skin discoloration or bluish of the skin. The other patients came and asked us about why the plasma make the pain. After we inject the plasma, we will inject a large amount of the plasma at the site of the injury that make pressures on the surrounding tissue of this site and also make the swelling of this side. After that, making the high circulation in this side. For that reason, there is a collection of the too much platelet in this side that's help to recover the injury site. If some patients ask us if the plasma is a permanent treatment or is it's not permanent. Really, it's not the permanent treatment as we described before. It will be last for the 6 to 8 months, mostly at about 1 year, the patient get benefit from the plasma injection. Other equation that the success rate of the treatment of this treatment is how much? It's about 70 to 80% the successive rate of this treatment, and if you compare it with the steroid injection, there's a big difference between them, and it's a natural injection. It's not like the steroid, and the complication of this injection of the plasma, if you compare with the steroid, is too much less. Who should not do the plasma injection? It is not possible for every patient to take the plasma. Example, if the patient have the infection at the site of the injection, if the patient have the metastatic tumors or tumor at the site of the injection, if the patient have the blood disorder like bleeding, clotting disorder at the site of the injection, for those patients it's not allowed to be take this injection. There's something that all of us, we are not knowing, or most of us ignoring about this tissue, that it is need the preparation before and after the injection of the plasma. At least the patient 2 weeks before taking the injection, they have to be avoided from the non-steroidal anti-inflammatory drugs and supplements 1 week before we give the patients this treatment. And after the injection, the patient should be avoid using the ice packing or hot packing for 72 hours and hot bathing for 1 week, and should be avoid alcohol and smoking for 1 week if the patients want to get the good benefit from this issue.